I'm so glad to have you here today. Thank you for making the time to speak with us.
Oh, of course. I'm so excited. I can't wait.
Same. So I'm going to give a little introduction as to who you are for everyone that joined. So everyone, this is Dr. Maura Weinstein Velez. She is a board certified dermatologist based out of Rochester, New York. And this is our second IG Live. And we are here to focus on facial rejuvenation as we transition into the winter season. So I'm going to go ahead and start with a few questions that we thought of. And the first thing is we would love to start us off with why the fall season is really considered laser season.
Yeah, no, so this is a really hot topic right now. And the reason why is because in the fall, our skin has less sun on it. And one of the big no-nos about doing lasers is doing lasers when you're tanned. And so a lot of times during the summer, when we talk about laser procedures and laser resurfacing, we have to wait for the patients to come back when they're not so tanned. So that's the first thing. The second part of it is that we are less likely to be going to get tan after these laser procedures. So for example, once we do the lasers, our skin can feel hot, a little bit uncomfortable, swollen, depending on what type of laser procedure we perform. And then the last thing we want you to do is go on vacation or go out into the sun because it'll affect the way that your skin heals. And then the third part of it is that some of these lasers require some downtime. And so most people are willing to take a few days of downtime in the winter, in the fall winter time, as opposed to in the summer when we have busy schedules and perhaps won't have that time to recover.
And would you say what are the reasons behind people getting laser rejuvenation? Would you say it's just because of their sun exposure, or are there other reasons as to why they would get that?
Yeah, so there's so many different reasons as to why, one would consider laser. And I should just preface this by saying there's so many different types of lasers. And so what laser is right for you might depend on your age, how much sun damage you have, how much brown spots or textural issues you have. Maybe there's some acne scarring. And so there's a lot of different reasons why one would get a laser. I would say in my practice, the three top reasons why we do laser resurfacing is first off, discoloration. So that could be like brown spots from cumulative sun exposure over time versus hyperpigmentation. Some people have a little bit of melasma or even spots left over from acne. So, pigmentary issue is usually the first reason why people come in for laser resurfacing. The second thing would be, fine lines, wrinkling, just overall facial rejuvenation, right? So lasers can help to soften lines on the skin that have developed over time. They can also help to sort of make the skin look a little more radiant, give it a glow. And so it's a nice way to give your skin that boost after a long summer of perhaps being in sun exposure. Maybe you have kids and you're outside watching sports all the time, or maybe you have a little bit of sun damage already. So a laser resurfacing procedure is a nice way to clean up the skin and get your healthy glow back.
Awesome. And if you're a new patient to lasering, what would you say like the no-nos are? Like, are you not supposed to be in the sun often? Is that really why fall season is laser season?
Yeah, if you're a brand new patient to lasering, certainly you don't want to come in, like I said earlier, with a tan or with even a fake tan, so a spray tan. Lasers are very smart, right? So they all have what we call a target chromophore. And that target chromophore is either water, melanin, or hemoglobin. So basically, they're targeting pigment, melanin, water, or hemoglobin, which is blood vessels. So if you have a fake tan on the skin, the laser is going to see that pigment. And your lasering is going to appear very uneven afterwards. So we want you to come in with clean skin, no makeup, no tan, and we'll be able to sort of guide you as to what best procedure would give you the best outcome.
Awesome. And I'm seeing here in the comments we have a few
Yeah,
questions. So
sure.
jump into a few of those as well. Drea G said, can you explain Fraxel laser skin resurfacing, is anyone a candidate?
Yeah, so that's a great question. So let's talk about different kinds of laser. So the Fraxel laser is a non-ablative fractionated lasering device. And all that means is that it delivers little columns of heat into the skin. It doesn't vaporize tissue or anything like that. It's exclusively heat, energy in the form of heat. And it's delivered in a fractionated manner. So it's kind of like every other piece of skin is being treated. We liken it to aerating the lawn, for example.
Mm-hmm.
The reason why it does this is to allow some normal skin in between to help with that healing process. So there's less downtime and faster healing. What the Fraxel is great for is all of what I said actually. So acne scarring, fine lines and wrinkles, a little pigment here and there. So Fraxel is a really great procedure. You can sort of dial it up or turn it down, just depending on what we're treating.
And would you say that the pros for the Fraxel laser treatment is the same as just like the normal facial rejuvenation laser treatment that you usually would give a patient?
Yeah, so there are so many different lasers. We could name all the names, but
Or
if you want to go into broad categories, so there are non-ablative fractionated lasering devices. And so in my practice, we use the Halo. You've probably seen a post on that a little bit. The Fraxel is a very similar device. We also do a lot of clear and brilliance. And so this is the same concept, a non-ablative fractionated laser. However, clear and brilliant is a much lower energy device. And so we can use it year round. Contrary to what I just said, it is appropriate to use year round, but it's not going to give you as dramatic of results as, let's say one or two Fraxels or one or two Halos. So that's sort of the non-ablative fractionated lasering category. Another category of lasers is or not IPL, which is intense pulse light. It's actually not a laser; it's a broad band of light that's emitted. But a lot of people hear about IPL. Another way to think of that is, a great treatment for reds and browns. So that's going to be more of a superficial type of laser procedure. And we definitely don't do IPLs if you're tanned. And there's really no downtime. So there's lots of different lasers. It just depends
yeah.
on what we're treating.
Okay, that's amazing. So I definitely think that if someone is looking to do laser rejuvenation treatment, it is so important to kind of know the differences between the lasers. And of course, you as the expert know these differences, which is why someone would go into your practice and ask these questions and get a consultation. So I know you just mentioned all of the different types of lasers that you offer, like clear and brilliant. For laser rejuvenation treatment specifically, is there a certain type of laser you would use, or it really just depends on what that person is trying to accomplish?
Yeah, that's a great question. So there's a few things I take into consideration before I make a recommendation. And you're absolutely right that when you come to see me as a patient or a board certified dermatologist who's a laser surgeon, it's really our job to help guide you and navigate through all the different options and be able to offer you what's best for you. Um, Along the same lines, if we're talking about laser rejuvenation, like I said, I think about a few things. So the first off is downtime, right? So I can offer you, the Halo, which is sort of our big gun, but you're going to be signing up for a few days of downtime. Now, most people in Rochester, where I practice, they'll take it. It's worth it to have a few days off to get those dramatic results that we see. And so we're talking about, coming in for treatment on a Thursday, let's say, and you could go back to work Monday, but you certainly were not going to be wanting to go to a wedding on Saturday, as you're healing from the laser. So downtime is a big question mark. The second thing is budget, right? So different lasers have different price tags. Typically, the more aggressive, kind of more workhorse type of lasers are going to cost a little more, but you might not need as many treatments. And so, depending on your sort of work situation, your budget, I see a lot of students who would prefer to sort of start, in a lower range in terms of cost and then bump it up just based on how we're doing. I'll direct you according to that. And then the third thing is, what your individual needs and goals are. And so different lasers will help us to accomplish those together. And so really, there's no great recipe to it. It's just sort of the assessment, talking to an expert who can guide you and offer you the breadth of treatments in our toolbox.
Of course. And would you say that the average results are pretty similar throughout?
Um, Not necessarily, no. I think that, two Fraxels or two halo treatments will get you sort of to your end goal faster than two clear and brilliance, right?
Okay.
Because they're lower energy device. And so we're going to need more of those treatments to accomplish the same thing.
It's really amazing to kind of hear what each treatment, which each laser provides to people, because um, from a patient's perspective, they're probably walking in thinking that a laser is a laser. But in regards to laser treatment, as you were mentioning, there's so many different kinds, and they all have different strengths and outcomes. And would you say that because of these different strengths and outcomes, as mentioned, the downtime needed is going to always be different? So,
Yes.
for these patients that come in, is there sometimes scenarios where you're like, I can't afford a downtime? I have to go to work the next day, etc.
Oh, 100%. All the time. I would say it's probably 50-50.
Wow.
Um, and so we will plan according to your work schedule, your social schedule, how much downtime you can afford. Sometimes we will opt for a lighter sort of treatment initially and then have you plan for the downtime so you come back and get something a little bit more aggressive. There's different recipes, there's different ways to do it.
Of
And
course.
I always say, if we start with one device, we don't necessarily have to continue with that one device. We can sort of mix and match. There is a case for combination treatments and that being really valuable to the patient. So we can sort of tweak the treatments based on downtime, work schedules, social schedules, vacations.
And I know, as you mentioned, for facial rejuvenation laser treatment, I want to clarify to all of our viewers, is it completely different than laser treatment to remove hair?
Yes.
Okay, I'm just
Yes.
clarifying,
Yes.
because when we hear laser treatment, we initially in our brains think of, okay, hair removal. But in fact, we are talking about facial rejuvenation, which is so interesting. And in the comments, I see we have a question. If you've never had laser before, is there a specific laser you would recommend to start with?
That totally depends on what you want to accomplish. So let's just say you've never had laser before and you want to start an anti-aging routine. Let's say you're in your mid 30s or maybe like early 30s and you want to know where to start. And so if that's the case, which are a lot of my patients' stories, I recommend starting with something light, where there's little to no downtime, but that will get you um, more benefit than, let's say, a facial or microdermabrasion. And that would be the clear and brilliant. So a lot of people come in and they've been having facials every month or they've been doing microdermabrasion. And that's perfect. That's great, maybe for your 20s or when you're in your late teens. But as you start getting a little older, we really need to think about things that are going to stimulate collagen production. And that's what this more effective laser would do, like the clear and brilliant. So what, the goal is with this laser is to deliver energy in the form of heat in a fractionated manner in order to stimulate collagen production, to get your skin back to where it used to be when you were much younger. And so the clear and brilliant can be performed as often as every month. But I have a lot of patients who just come in quarterly. So they get it, 4 times a year. And that helps to maintain the radiance, the texture, the glow, the brilliance of their skin.
I see. And I know I asked you before what the notes of rejuvenation treatment are, but I see here, if you had filler or Botox in your face, is laser treatment still safe?
Yes, we do a lot of lasers before we do the injection. So I typically would do, let's say you came in for a Clear and Brilliant treatment, I would do your Clear and Brilliant, and then we could do some injectables right after. So let's say you wanted to do some wrinkle relaxers like Botox or Dysport or Xeomin, we could do those after. I would not do fillers after the laser, and that's just because sometimes after the laser you can have a little bit of swelling and it will alter the way your face looks. And so I don't, it's just my practice where I don't want to fill when your face might be a little bit swollen. I'd like to see it in its sort of natural state.
That's awesome to hear. And I mean, I went through all on my end, but I wanted to know from you as the expert, is there anything else you would like our viewers to hear about laser rejuvenation for your face? Is there anything specific? If you guys have any questions, please feel free to drop them in the comments below, and we would love to go over them for you all as well.
Yeah, so I think there's a few points. The first is that um, some of the lasers can help to clean up sun damage on the skin. And so, as dermatologists, we see a lot of patients who have what we call actinic keratoses. And these are little areas of sun damage from cumulative sun exposure over the years. And
Okay.
lasers can help to clean that up because it's sort of delivering energy in the form of heat, giving a good exfoliation, starting from a much deeper level, and can help to sort of slough those after the treatment. What we would do in the office for these spots is use something called liquid nitrogen or cryotherapy. And a combination of liquid nitrogen and these lasers can help to clean up sun damage. So it's not all about, like wrinkles and, people start thinking this is very superficial type. These are superficial types of procedures, but it can actually help improve the health of your skin. So I think that's really important to consider when you think about lasers.
And is the IPL laser the best for sun damage?
No, not necessarily. I'm actually referring to some of the non-ablative fractionated lasers like the Fraxel or
Okay.
the Halo. Yeah. Lasers are also great for under eyes. So eyes have been a big topic lately because, we're wearing masks. And so everyone is just looking at eyes. And I've had a lot of requests from patients to address under eye wrinkles and hollowing. And lasers are a great way to help to smooth that crepey skin and resurface the skin under the eyes and even on the top, on the lids. So that's another sort of niche thing that we can accomplish with lasers.
It's super interesting to hear everything you can accomplish with the laser. Because as I said earlier, most of the times you would think it's about like hair removal and not really resurfacing your skin or even improving the health of your skin. So it's
Right.
so amazing to hear everything you have to say on your end, because from a patient's perspective, these facts are very unknown until you go in and you hear from the expert yourself. So I am so glad that we were able to have this conversation and engage with our users and our viewers and really help them understand what lasering really is. Because I think it's such a misconception, because no one really assumes that you can use it for your under eyes, to improve the glow of your skin, and for your eyes being such a sensitive spot. Is there a topical cream you would use to help with the pain? Um,
Oh, yes.
okay.
Yes. Yeah, it's a great question. We hadn't covered that. So a lot of, lasers aren't painless.
Of
And so prior
course.
to the procedure, right? So, prior to the procedure, we always use a topical numbing agent. And that's usually a cream that contains lidocaine at a stronger percentage. And so we would have you sit with the lidocaine on the skin for about 60 to 90 minutes. And a lot of people would say, like, oh, 90 minutes, that's a long time. But quite honestly, the longer the numbing is, the better the procedure is, and the less pain, the more tolerable for you as the patient.
And
So there's always some sort of numbing.
of course. And can you take like an oral medication to kind of help alleviate the pain, or usually the topical cream is enough for that patient?
Yeah, usually the topical cream is enough. There's other things that we use during the procedure, like cold air, that helps with the pain. And then typically after the laser procedure, there's no lingering pain. Like I said, there could be a little bit of swelling, but it's not something that should keep you up at night or be sort of a lingering issue.
Understood. So it's very much on impact type of like pain, I would say. I wouldn't even,
Yeah, yes.
maybe like an uncomfort as well.
Yeah, it's just a little bit uncomfortable. It feels, there's different ways to describe how it feels. Some people say it feels a little bit spicy, prickly. Yeah, it's hot. Some people say it feels like, tiny little needles. It's all, improved once the numbing has been on for a while. It's very tolerable.
Of course. And as of course, all have different tolerance levels
Yeah, yeah, very true, very true.
on how well we react to things that would essentially hurt us or make us feel uncomfortable, especially in our face. I feel like a lot of the times people are really, do you find that people are hesitant getting facial rejuvenation because it's their face?
Yes, so that's definitely a concern. I think there's a level of trust that we develop when they come in, which is, very, very important. We always talk about expectations. I walk them through the procedure, help them by showing some before and afters. And we actually have some series of photos where you can see kind of what to expect on day one and on day two. I actually just posted something on that the other day
Everyone
in my stories. Yeah, just sort of like what you might look like on day three. And so I'm happy to share that as we come, as patients come in and we do the consultation. Um, the other thing is, my nurses, I have to give them a shout out, are so excellent. They're always checking, calling, making sure everything is okay, making sure, the recovery is okay. We give you a little goodie bag of products to use post procedure. So it's quite a lovely experience, actually. And just on that note, I'll say that, one thing patients get worried about is that it's going to make them look like a different person. And that is just not true. And this has sort of been a theme on a lot of my posts lately, where just because you're coming in for a cosmetic procedure or a procedure where you have to pay out of pocket, it doesn't mean that we have to change the way you look. It's really just turning back the clock and helping your skin, rejuvenating the skin. It is what it is. It's rejuvenation, giving you back that glow, sort of helping you feel more comfortable, more confident. That's why I do what I do, is just to help empower women and men so that they can look and feel their best.
Do you see a lot of men come in for facial rejuvenation treatments?
Lately, I have. It's
Really?
been quite refreshing. I love my male patients. I think they didn't really know. A lot of them don't really know that they can have these sorts of treatments. And once they take the plunge, they're regulars. And
Hooked.
I love it. Yeah, they're hooked. They're hooked.
That's so interesting to hear. Would you say that for facial and rejuvenation specifically, there's a certain age that people would start coming in to get these treatments done?
Yeah, I would say late 20s, early 30s is a good time to start considering some sort of, overall facial rejuvenation treatment.
That's awesome to hear. So usually like the younger the better because you're kind of in that phase where anti-aging might be starting. Is that really why?
Yes, the reason being is because we know that as early as 26, 27, you stop producing new collagen. And so you'll notice that your skin might be a little bit drier. It might not have as much glow to it. You might start developing brown spots that stay. You might start noticing lines that are forming on your forehead that don't go away like they used to, just normal expression lines. So it's very dependent, like I said, on cumulative sun exposure and genetics and and skin color and type, a lot of other factors. But we know at that sort of age range, we need to really keep an eye out on the skin and how things are changing because we stop producing as much collagen.
Of course. I mean, it's so amazing to hear how these benefit your skin, especially because for anti-aging, we just assume as we get older, it just happens. But realistically speaking, there's a whole understanding behind it. As you said, the collagen stops to produce as doesn't produce as much. So it really is dependent on a lot of factors that we are unaware of. And just speaking with you and hearing all these questions our viewers had to ask us, it is so amazing to hear how successful the laser treatments have been for people. I even saw one of the comments. I forget know what her name was, but it was one of your patients saying how incredible the clear and brilliant laser was. And it's so awesome to hear on my end, and I'm sure on your end as well. The positive feedback you get from these treatments, and as you said, it's really why you practice, and you are always just continuously benefiting people's life. So speaking to you has been so amazing, and for everyone watching, thank you so much for tuning in, and I hope you were able to send in your questions. And if you have any more questions, please feel free to add Hope Beauty on Instagram, add Dr. Mara Weinstein on Instagram. She is always active. As she said, there is such amazing content on her feed. Always, I have to say, you're one of my favorites when
Thank
it comes
you.
to rejuvenation, because as we do get older, it is something that we need to be aware of, because if not, we're just going to let ourselves age, and there's always things to help. So
Yes,
thank you so much for your time today.
of
If you would
course.
like to of your words for our viewers, go ahead. The floor is yours.
Oh, thank you so much, Brooke. It's so fun to talk to you. I love these discussions. I hope that we can reach everybody who needs to hear this, sort of like a consultation, you know, what you would hear when you came to the office. So I think it's really beneficial for patients, especially those who might be hesitant to come in and ask these questions. And so I'm happy to keep doing these Q&As, and just love taking questions and helping as much as I can.
Of course. Thank you so much
Of
for your
course.
time. Thank you for still on and tuned in. You guys are amazing. And have an amazing Tuesday.